Hello, I'm Martin Raniowski, your Executive Vice President. I would like to start by thanking you for participating in the 2020 Pennsylvania Medical Society's House of Delegates and for representing the House of Medicine. Where do I start after the year we've seen? At the beginning of 2020, I thought we'd be talking about the Supreme Court and venue shopping, maybe prior authorization or surprise billing. However, as the virus spread across the nation, terms like social distancing, pandemic, personal protective equipment, and stay-at-home orders became the common language. Instead of working towards cutting administrative red tape, the Pennsylvania Medical Society fought to keep physician practices open, expand the use of telemedicine, and source PPE supplies. Just as you continue to be there for patients, the Pennsylvania Medical Society is here for physicians. I am proud of PAMED's Corona Response Team, or CRT for short, which was formulated in early March before the pandemic was at the forefront of everyone's mind. Our team created educational materials explaining new executive orders, federal rules, and provided a comprehensive list of available resources. The CRT also developed a website with materials and information that was recognized by Governor Wolf and NPR as a trusted resource in the Commonwealth. This team heard our members when you expressed concern over PPE availability. We worked with a national supplier to get critical supplies directly to practices. We understood your urgency for personal protection and your need to provide care for your patients. And as you began to reopen, we provided guidelines for practices and patients. Even today, the CRT meets regularly to update information, assess the current environment, and anticipate future needs related to coronavirus. Not only was the CRT hard at work, your government relations team was at the forefront of advocacy efforts related to COVID-19. They worked to expand payment for and use of telemedicine. They fought to provide limited liability protection, decrease prior authorization barriers, and include private practitioners in Commonwealth funding opportunities. During this stressful time, our PHP program created a free webinar for employers and physicians to identify the warning signs of true clinical concern that needs immediate intervention. Yet, PAMED was not only focused on COVID-19 issues, we kept all of our services fully operational. The Knowledge Center was available for every call and email for members. These critical staff guide members through difficult and confusing times. Our practice support continued to navigate physicians through the quagmire of insurance complaints, federal and state regulations, and the new rules of engagement set by COVID-19. And let us not forget that 2020 is also a relicensure year. The educational staff have updated opioid training and many other critical CMEs in order to ensure resources are available for physicians to obtain required hours of CME for their relicensure. The team department also had to shift all their client meetings from in-person to virtual, often in less than 60 days. Not only did they accomplish this, but many clients commented on the quality and effectiveness of these meetings. PAMED also stands with those who are fighting for equality. We firmly believe that every Pennsylvanian should have equal access to quality health care. Care should not be determined by the color of your skin, sexual orientation, or religious belief. In fact, PAMED has created a diversity task force to look at and provide these actionable items. First, increase diversity in the physician workforce. Second, remove systemic barriers to medical school. And third, incorporate social determinants of health and inherent bias training in medical education, residency programs, and CME. During this unprecedented year, your dedicated PAMED staff remain committed to providing quality services and minimizing disruption for you. If this pandemic has shown us anything, it's that PAMED remains a nimble leader committed to you, our physician members. When others were heading home to protect themselves, you stayed and provide frontline medical care to the citizens of Pennsylvania. When many said they would rather isolate themselves than go back to work, you demanded to reopen your practice and provide care that was too long delayed. You did this knowing that conditions were not optimal, patients would be frightened, and there would be a shortage of supplies. For all of that and so much more, and on behalf of all the staff at the Pennsylvania Medical Society, I humbly say thank you for your dedication to this noble profession.